If you're looking for a career change or a new job, you may want to consider working in the field of respiratory therapy. Respiratory therapists are essential in our healthcare system and help patients breathe better when they're sick or moving to another hospital. Joining us now is professional lead in respiratory therapy, Candice Harmon. Good morning, Candice.
Good morning.
Thank you so much for joining us this morning. Now, you've been doing this for 15 years. What led you down this path in the early days of your career?
Yeah, so I was driven to something in healthcare and wanting to help patients with their care needs. And so this one was enticing because it has a mix of teamwork. It also allows for 2 days of the job to not be the same. So I'm able to do different parts of my role in an hour-to-hour kind of basis with different patients. It's also a really great mix of technology with patient care. So as technology advances, so does the profession. So it's always evolving, which is nice.
Yeah, okay, so tell us what it is exactly. What does a respiratory therapist do exactly?
Yeah, so respiratory therapy is a specialized role in the healthcare system, and we work with different patient populations and in different areas of the healthcare system. And so that can be, if you think of the role as primarily people who are having trouble with their breathing, that can be from birth, so premature babies whose lungs may not be fully developed, to children with respiratory illness, and then all the way up to adults who might have kind of end of life stage.
Right, and during COVID you were swamped.
We were swamped, yes. We got a lot of attention during COVID. The role was kind of highlighted a little bit more because it was a respiratory illness, and we do manage those ventilators that patients were on.
Saving lives every single day.
Yeah.
Yeah, and so is that part of the perk of the job as well? You know that you're really valuable?
Yes, for sure. So we're, again, part of this healthcare team and working interprofessionally with other professions, but it's definitely a perk, helping someone with their essential skill or essential function of breathing. So that's, yeah, it's very rewarding. It's almost that instant gratification.
Okay, but there is a need for more.
Yes.
So what's the situation now in terms of what your need is when it comes to new trained people?
So we do have an intake of 40 students into the program, and it's a 3-year program through the University of Manitoba. You do need 24 credit hours of prerequisites. Okay. So take 40 students, and the application deadline is May 1st.
Okay, so if someone's already has a career but they're tired of it or they're looking for a different path, why is this a good career change?
So it's nice because it's necessary and needed in this province. So we do need respiratory therapists. It's nice that students have a job usually halfway through their final year, so they're already being offered jobs before they graduate. So.
And it's something you enjoy. You enjoy spending time with patients and seeing your work actually being fruitful.
Yes, exactly. And so it's that instant, which we talked about, instant gratification, but it's also, there's a role in primary care, in home care, in patient education, so we're able to kind of help in many aspects of the disease.
Okay, so if someone's watching right now and they're thinking, this sounds like something I would love to do, what should they do?
So I think that looking at the University of Manitoba's website, there is information there on what the role is, and then Health Careers Manitoba also has a website that talks about the role a little bit too.
Okay, and you should enroll soon, right?
Soon, May 1st is the deadline.
And that has been extended from April the 1st, and so you have lots of opportunity to get prepped for that. Thank you so much for sharing this with us, and of course if you do want more information, we have a link on our website. Thank you.
Thank you.